In today's agenda, what we will be learning is the introduction about Arskog syndrome, the history and background information, symptoms, behaviors, complications, the cure of Arskog syndrome, and what occurs and how do you get it.
Hello, my name is Dr. Baltadano, and I'm a medical geneticist. If you don't know what that means, it is a clinical physician that evaluates, diagnoses, research, and helps manage patients with hereditary conditions. Today, we will be talking about Arskog syndrome and the effects that it has on people. So let's start. Some background information about the history and where Arskog syndrome originated from and who discovered it. Dagfinn Arskog was a specialist in pediatrics from the year 1964 and in medical genetics from 1974. In the period of 1964 to 1965, he worked as a researcher assistant at Johns Hopkins Hospital until in 1970 when he first described Arskog syndrome. He noticed that the inheritance that the X-linked and autosomally recessive had, which made him make a discovery. The real question is, what even is Arskog syndrome? Arskog syndrome is a rare genetic condition characterized by short structures and multiple facial limb and genetic abnormalities. It affects the development of many parts in the body, most commonly in the head and face, as well as in the hands and feet. The behaviors that Arskog syndrome give is increase in temper tantrums, demanding controls, and abusive, assaultive behavior. Now, how can you spot this? To spot Arskog syndrome, you might notice facial features like a broad forehead, wide set of eyes, and a flat nasal bridge. Additionally, individuals with Arskog syndrome may have short features and or abnormalities in their hands and feet, such as webbed fingers or toes. Development delays and learning difficulties can also be signs. Remember, it's important to consult with a healthcare professional for an accurate diagnosis. Some complications of Arskog syndrome are ocular hypertelism, small hands and short palms, finger deformities, umbilical and inguinal hernia, genetic abnormalities. Broad and short feet are also. Sadly, there is no cure for Arskog syndrome, but there are treatments focusing on managing symptoms and providing supportive care. This may include regular medical checkups, physical therapy, speech therapy, and educational support. It is best to consult for personal guidance and treatment options. The internal cause of Arskog syndrome is because Arskog syndrome is caused by mutations in a specific gene called FGD1. These mutations affect the development of various tissues and organs in the body. It's important to note that Arskog syndrome is a genetic disorder, which means it is inherited from the parents who carry the mutated gene. The chance of getting Arskog syndrome depends on various factors, including whether or not the parents carry the mutated FGD1 gene. Arskog syndrome is inherited on X-linked recessive patterns, which means it primarily affects males. If a mother carries the mutated gene on one of her X chromosomes, each of her sons have a 50% chance of inheriting the syndrome. Daughters of a carrier mother have a 50% chance of being carriers themselves. However, it is important to note that not all individuals with Arskog syndrome have a family history of the condition. In some cases, the syndrome may occur due to spontaneous genetic mutations. Genetic counseling can provide more specific information based on an individual's family history and genetic testing. There are researchers and scientists who are actively studying Arskog syndrome and working towards finding potential treatments or interventions. They are conducting research to better understand and the underlying mechanism of the syndrome.
Over here is a patient. He has Arskog syndrome, and it says that it's a very rare genetic disorder that affects the facial appearance, height, muscle, skeleton, and genitals of a person. It's inherited as a X-linked trait and caused by mutations in the FGD1 gene, and its estimated population prevalence of around 1 in 25,000 to 1 in 1 million. Due to the spectrum of characteristics and lack of knowledge, Arskog is often not or misdiagnosed. Zachary has many of the common characteristics associated with Arskog. In addition, he has many of the less common associated ones such as metatarsus adductus, congenital pietis, astigmatism, Balarum, amyopia, Balarum hyperemia, autism, asthma and allergies, development delays, attention activity, and sleep issues. Zachary's portrait, which is in the left, is part of Beyond the Diagnosis Traveling Art Exhibit. Their goal is to raise awareness and advancement in the medical community through art. Over here are the examples of multiple patients with Arskog syndrome. Patient 2B and 5 have wider eyes, while patient number 3 and 4 have wider foreheads. Each patient has their own individual problems. Some have wider eyes, and as you can tell, 2A's nose is more bridged than 2B.